Hello and welcome to the EduTalk series hosted by Biotone, Biotone EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Eric Purves, a Canadian massage therapist, with a master in rehabilitative science who specializes in pain science. He's founder of the Center for Evidence-Based Education. And tonight, Eric will help you understand and apply the latest information about massage therapy and pain science into your practice to achieve optimum outcomes for your clients. Let's listen and learn as Eric asks and answers, what does massage therapy do? How does it actually work? What are the mechanisms of touch? And how does the profession of massage therapy positively influence an individual's experience of pain and function? And what are the potential psychological and emotional benefits of massage? No time to read the latest research on massage therapists? Eric will provide an overview of the current science of massage therapists. And again, thank you for joining us. Thank you for having your sound muted, video off. And Eric, welcome to the EduTalks. Thank you so much for joining us and discussing the science of massage. I know you have a lot to get to, so I will exit and come back on to join you for chats.
Sounds
It's
good.
all yours.
Thank you, Danielle. That was a very lovely introduction, and I don't think anyone's ever called me an expert before, but it kind of feels nice to hear that. So thank you. Thanks everybody for being here. For those of you who are live, I appreciate you all, and people watching the recording, I appreciate you all, and I appreciate your interest in this content. This is a 45-minute version of a larger 3-hour course. And it also, this material though that I'm gonna be presenting to you this evening is forms what I say the foundation for a lot of the other courses and content that I teach. So I'm gonna try and give you a lot in a short period of time. So I'll try not to speak too fast, but I'll do my best to get through it all in our allotted time. So here we go. So don't want to talk too much about me because what matters more is the science, but just so you know a little bit about who I am. Well, I'm a below average guitar player. The first job I ever had was teaching guitar. And I still play a little bit, but I'm not as good as I used to be. So that's why I say I'm below average. I'm also a soccer coach. I'm actually get work for a local soccer club here on the west coast of Canada. And I get paid probably the worst paying job in the world, but it's also the most fun job I get to do. So when I'm not playing guitar or teaching courses or researching courses, you'll see me on the soccer field. Family man, I have a family, I got a wife and 2 daughters. I've been in the profession, the massage therapy profession here in BC and in Canada where I am. It's called RMT. I know there's LMTs, then there's just MTs. There's a bunch of different acronyms, but I've been in the massage therapy profession for over 20 years now. I'm a researcher, so I have a couple published papers out there that are all looking at massage and the wonderful things that massage can do. I'm an author. I've got a couple articles that are not research-based articles, but opinion pieces. Those can be found out there too. And an educator. I have been teaching massage primarily in the continuing education world for over a decade now. And I'm a podcaster. So about 3 years ago, 4 years ago, I started my own podcast, which is called Massage Science. And you can find that on any of the podcast networks. And also curriculum advisor. So what I've really tried to do in recent years is I've tried to take the science of massage and try to incorporate it into the history, the traditions, the culture, the things that make massage as wonderful as it is. But I've tried to update it with and incorporate some little slightly different understandings. Sometimes there's a big in difference in the understandings, but I've tried to do that a bunch. And so the last few years, I've had a few schools I've been fortunate enough to work with. So the science of massage therapy. So if we can just summarize everything in a couple points, this is what I would like to say. I would like to say first off that massage therapy is amazing. We know it's amazing. Doesn't matter what you do. If you're working with your hands and you're making people feel good, doesn't matter how you call it, it's touch, it feels good. And we know that massage is amazing and it can have a massive impact on people's lives. I strongly believe that massage therapy is a healthcare profession. Now, depending on where you live and how you practice, some people might not agree with that. But for where I live and the way I've been involved in this profession, I really do think that we should view ourselves as a healthcare profession. It's something that is can work alongside musculoskeletal care professionals of all types. And what we provide as a profession, I think, is so strong because we have the gift of time, the gift of building relationships. We can provide the gift of touch to people to make them feel better, and that's healthcare. Massage therapy is, if we think of massage therapy as a profession, I think it's important for us not to think of massage therapy as a specific intervention or a specific modality. We all have different ways of touching. We have different named techniques, different trademarked treatments that maybe we have invested in. But those are just pieces of the greater profession of massage therapy. So the stuff I'm going to talk about today, I'm not going to be talking about specific modalities or specific interventions or the science behind that because that just takes us way off topic. But what I'm going to focus on is the just the science of touch. So massage therapy is very basic core is the science of touch. And that's really what I want everyone to leave today, is having a better understanding of that. And we know massage can help people live better. We have research that shows that people that get massage can feel better about themselves, physically, emotionally, psychologically, mentally, socially, all those things. And the thing that we need to really embrace and understand is that massage therapy treatment outcomes are not because of specific techniques. And this isn't, and I don't say this to say that specific techniques aren't helpful, but I'm saying that people can get better with a variety of different styles of touch or ways of touching or ways of providing therapy. And then what technique or what approach might work best for one person, that same approach might not work best for another. The science, the art of what we do as a profession is to find how do we apply the technique that we're using and how do we apply the approach that we're using and how do we use that as best as we can with the individual in front of us because every human is different, every therapist is different. And if we start thinking bigger picture and not just about what technique or tool should I use, but more about how do I apply this tool or this technique to the person in front of me, that is the art and the science of massage therapy. So what can we claim as massage therapists? What are the defensible claims? Well, the first one I can say is, and we know this, is that there's good evidence to suggest that massage therapy can help with symptom management of physical pain and it can improve function. Now, sometimes for us as massage therapists, we may see massive changes. People may feel a lot better after a treatment. Sometimes they might feel worse. But we hope that more often than not, when people come to see us, they'll leave the room feeling better than when they came in. And if we're looking at the science, what's the evidence suggest? The evidence suggests that yes, we may only have a small increase in pain management, so decrease in pain. People might feel a little bit better, a little bit less pain. They might have a little bit more function. And that is hopefully clinically meaningful for some people. But when we're looking at pain and particularly chronic pain, not a lot of things work very well. Some things work better than others, but not a lot of things work very well. But there is enough evidence to say things like touch, movement, exercise, all might have a very small effect size, but I don't think we should dismiss that because I think that can be really important, particularly for people that are living with chronic, ongoing, debilitating pain. And massage therapy also can say that we can make claims that it's good for mental health. And I have some references on the next slide, I believe it is, that looks at that there's temporary alleviation of mental health symptoms, so depression, anxiety, and stress. And these effect sizes are actually quite significant. People that have or they're living with or suffering from depression or anxiety, for example, when they get massage, the outcomes, the benefits are almost equivalent to that, the same as psychotherapy, psychological interventions. They're not huge, but they're meaningful and they're enough that we can say, hey, people that are suffering with these mental health things will feel better after a massage. Now, the thing we have to be mindful of is that we can't, it's outside of our scope of practice to counsel or to treat depression or anxiety or stress. We can't treat those things because they're out of our scope of practice. But people that are living with these things, when they come for massage and we provide a massage that feels good for them in a safe environment, we listen to them, we let them know that they're okay. This can be very, very powerful and can help people a lot. And if we look at things like depression, anxiety, and stress, and we look at the relationship that those have with pain, we see that there is actually a strong relationship, a correlation between those mental health um, conditions as well as pain. So these things are important. And the last point here I have is improved interoception. So interoception is that kind of like internal sense of how do I feel, what's going on in my body. Well, physically, emotionally, mentally, massage can help to make you hopefully feel overall better in yourself. So massage, I said before, the last slide is that massage can help people experience pain differently. Well, how? Well, the first thing is that is the feel good touch and our contextual factors. And we'll talk a little bit more about that, about how, what mechanisms are involved. But if we're looking at kind of three most common ways in which massage can help people to experience pain differently, and this could make their pain feel worse or better. We want to make it feel better, obviously. But through the skin, right? We are touching skin. This is the first organ we're putting our hands on when we are working with a human. And we know there's neurophysiological effects that happen in the epidermis and the dermis, so the upper layers of your connective tissue in your skin. And when we're putting our hands on people, we're massaging, whether we're compressing, sliding, stretching, whatever it is we might be doing, we're going to be stimulating these stretch and mechanoreceptors in the skin. And when these are stimulated, it actually has a effect that it blocks noxious stimuli or slows down noxious stimuli so things don't get transmitted from the area that's sore to the spinal cord. So it slows down that stimuli so that way there's less chance that you're going to have an awareness that there's something um, potentially harmful in the area. Basically acts as a block. It slows things down. We also see that at the level of the spinal cord, without getting into a huge neuroscience talk here, that when there's touch that feels good, there's also enkephalons that are released in the spinal cord, and these are act as a endogenous opioid, as a self-made painkiller or pain analgesic, I guess is a better word, that again will slow down that nociceptive, so that noxious stimuli. Without going into a huge discussion about nociception, that's when you feel a sensory input of something that doesn't feel good. Right? If you poke yourself, you smack yourself, you burn yourself, it hurts. You've activated those nociceptors primarily in the skin, what we're talking about here. And there's also subcortical, so as we move up into the brainstem, we also have these another innate kind of pain control system where your body releases opioids, cannabinoids, there's oxytocin and dopaminergic pathways. And what happens with this is that when there's touch that feels good, and when there's contextual factors, what I mean by contextual factors is that environment, that trust, that safety that occurs when someone comes into a massage therapist's office or clinic. They're on the table, you're doing your wonderful things with them. We have skin, spinal cord, and brain I mean, this is the very unscientific word, stuff that occurs that helps to basically flood your system with feel-good hormones and neurotransmitters are released that basically help to stop or slow down that transmission of noxious stimuli. So this is why, if we think about it, and this is the way I always like to think about it, is that when someone gets off the table and they feel a little bit dopey, they feel, oh, my shoulder doesn't hurt as much anymore. And we have lots of other stories of things that it could be. We think it could be a muscle, or it could be this tissue, or it could be, a joint or whatever. We have all these different stories, and those things might be involved. But the stuff that's most defensible from a scientific perspective is that when we've done a massage, we've kind of provided just some really good information into their nervous system, into the neurophysiology, and that's helped to kind of slow down the transmission of those noxious stimuli. And people feel a little bit dopey because I think it could be wrong, but what makes sense to me is that because their system's flooded with natural painkillers, so they feel kind of good. We do all this and we reassure, we educate, and we provide movement or exercise if that's within our scope of practice. These are all things that we can do to help people experience pain in a better way. And this is one thing that I find is missed in so much massage schooling and even in the continuing education world is that we focus on all the stuff underneath the skin, which has a role to play and it's important. But really, if we think about what we're doing with our hands. As soon as we put our hands on people, all the information that the rest of the body, the rest of the systems are getting, it comes from that first touch, which is in the skin. And if we look at things from a developmental perspective, an embryological perspective, our skin develops from the ectoderm, which is the same um, developmental layer as the nervous system. And there is I think a good argument to be made that the skin is just an extension of that nervous system because it's communicating directly with it. We have all those nerve endings and those receptors that are in the skin that provides a whole bunch of information about what's happening into our external environment as well as our internal environment. I'm not going to go too much more into the skin, but I think it's just an important thing just for us to think about. Now we say this, and it may sometimes I talk about the stuff, and it may sound like I'm being dismissive to specific approaches, and that's not what I'm doing. But this quote, I like this quote. It says, "Criticizing ourselves is the mark of a positive, confident profession." What I want is I don't want us to criticize what it is that we're doing, but I would like us to stop and think about maybe there's a different reason. Maybe there's a different explanation for why what I'm doing is working. And if we don't ask these questions, we don't have these conversations, then the profession is not going to grow. And I see such a massive opportunity for the profession of massage therapy throughout Canada, the US, the world, to be able to really move into this kind of mainstream healthcare profession, just like physiotherapy or physical therapy. But hopefully better because we have that gift of time and that gift of touch. So here's the five kind of key points about the science of massage or the science of touch. And this first one, this is old information, but I think this is so powerful, is that mammals are hardwired to need touch. Some of you may be familiar with some studies they did with monkeys a long time ago where they didn't allow them to be touched or didn't give them exposure to their mothers. There's lots of studies with other animals and rats, for example, where they've denied them touch and the animals die or they go insane. We are, as mammals, we have developed over time this ability, this need for touch. And there's studies that show that, touch, particularly in young people and in infants, newborns, children, it improves cardiovascular and respiratory stability. So as soon as a baby comes out, they put it on the mom's chest. So there's that skin to skin contact. It helps regulate their system. So they breathe and their heart rate is better. It improves your autonomic nervous system regulation. It improves immune function, and is also shown to enhance cognitive development. So touch, particularly touch in children and youth, babies, is so, so, so important. See tactile afferents. This is a really cool thing. These are low threshold mechanoreceptors. So these are receptors that are in that we have that are stimulated with low threshold, meaning it doesn't require a lot of stimulus for them to fire. These C-tactile afferents, they create a feeling of well-being. So some people call this affective touch. So when you put your hands on the back of somebody's shoulders or their neck or their back, and you do that nice slow massage that just feels delicious, that just feels good, most of that feeling of well-being is occurring because of these C-tactile afferent fibers are being triggered. And what's neat with this is that these fibers, they fire the strongest at stroking speeds of 1 to 10 centimeters a second with gentle pressure and warm hands. So what that looks like in practice is a slow, steady, warm hands pressure will fire those things and make people feel good. And this is the sensation that we all know what it feels like when you get that, just that perfect pressure, warm hands, not too fast, not too slow, and it just feels good. This is what's happening. And what's really cool with these too is that the highest density for these C-tactile afferents, these are found in the proximal areas around the posterior shoulder and the back. So what's the one area that is most important to people when they come in for massage? More often than not, if people are just feeling like they want a massage, they always feels great to have their upper back, their shoulders, and their neck work done. And that's where these fibers are in their highest concentration. There's some different ideas, some different theories about why that might be. The one that I like to think of is that there are areas that we can't get to ourselves. It's hard to massage yourself back here. You can do it, but it's not the same as if someone else does it. So I think these fibers and where they are and how they work really kind of blend well with number one, which means I think we're just hardwired to touch and to feel good with that nice touch. There is also cortical factors, so top down, so brain, belief, and environment, meaning. These things can all impact what touch means, how touch feels, right? Who's touching you, where they're touching you, when they're touching you, your relationship with them. A friend rubbing your back or a distant friend who you haven't seen in a long time feels much different versus somebody that you're close to or your massage therapist. The context is different and it makes us feel different. I already said there's antidepressant and anxiolytic effects, which means those anti-anxiety effects. There's multiple papers on that. And it facilitates emotional regulation. So this I mentioned this on the last slide about reducing the stress response. Your hypothalamic pituitary adrenal axis, when we're stressed, that is more active. When we're less stressed, it becomes less active. Well, that feel-good touch, that effective touch, actually will decrease activity in the HPA axis and will help to make people feel less stressed, make them feel more relaxed. And in my 20 years of experience as a massage therapist, stress was often one of the main reasons why people came for a massage because they felt it helpful. So these are things that a lot of us probably already knew or were familiar with. But my hope is now that you have some science to support or maybe inform a little bit more about what that is and why that's working. I want to highlight this paper which just came out. So I've already said massage is good for mental health, but it's called Touching the Mind, Exploring the Intersection of Massage and Mental Health. It's a paper that came out recently, like within the last month or two, that it's an open access paper. I think it's through the International Journal of Therapeutic Massage and Bodywork. I'd read it because it talks about this a bit more and about how where our profession could potentially go with a deeper understanding of the mental health benefits. Oops. The analgesic effects, I kind of talked about some of the skin stuff, but this is a nice diagram here from a paper that was written in 2018. And it's just gonna, if you follow along here, I got some arrows to make it a little bit easier, is you're providing that mechanical stimulus, you're putting your hands on somebody, it's activating the peripheral nervous system, so the stuff in the skin. It's sending that information to the spinal cord, and then the information from the spinal cord is then transmitting that up to the subcortical areas, and from there, meaning is made. Endocrine, so kind of immune and endocrine responses are sent into the bloodstream, and we get these this full-on kind of reflexive effects as well through the spinal cord. So we put our hands on people. There's a cascade of events, activates a whole bunch of different neurophysiological structures, and the outcome should hopefully be a little bit less pain. Now, these mechanisms aren't long lasting. They might only work while your hands are on them. They might only work for a little bit after. Maybe they work for a couple of days if we're lucky. Maybe they're enough to kind of break that cycle and the person feels better for a long time. But all the things that we're doing with our hands and all the techniques that we use with our hands, we can explain their outcomes through this entire process, this entire analgesic process. And some people might feel, oh, that's challenging. I don't like how that makes me feel because this is different from what I've been doing. What I want people, or how I think, what I want people to get from this is to not stop what you're doing, but maybe provide a different understanding about why it is that you're doing is working. And this is, I would say, is a current, less wrong, or some people might say more right approach or understanding to how does massage help people. Another paper here that we can talk about with the science of massage and touch, and this is again a paper that kind of concept brings together a bunch of the different things we've already talked about. But so yes, we know it helps with pain. We know it makes people feel less stress. This last point here, though, I wanted to say, and I don't know why they have to make this word so big, but somatoperceptual reorganization. Touch helps to give us a sense of ownership of our body. We can make an area, we can help it discriminate between safe or threatening stimuli. And we can also help to reorganize kind of the mental representation. An interesting thing that happens to some people that are in pain for a while is they tend to have the part of their body that's sore. So oftentimes a limb, sometimes it's or we can even say the low back. That body part doesn't feel like it feels different. It feels like it's out, or it feels like it's off, or it feels like it doesn't move as well as the rest of the part. And what we can do with touch is we can give them that sense of feeling back to that area to make it feel, but in air quotes, normal again. And I strongly feel that by providing touch that feels safe and not threatening, by not threatening means like it's a feel-good touch. And feel-good touch can be any depth. It can be point, it can be broad. It's whatever feels good to the person. That's what I mean by non-threatening. We provide that kind of touch, and hopefully can allow the person to feel better in their body again. Goes back to that point I made before about interoception. So all this being said is that we aren't changing anatomy. We may see and feel anatomical changes, whether body parts are moving differently, or they're softer, or they're smoother. Those anatomical changes that we see and feel and the person experiences are secondary to the influence of the physiology that we've interacted with. So if we're kind of flipping the script, we're not changing anatomy, we're influencing physiology. And by influencing physiology, hopefully those kind of anatomical, structural things that we may see and feel, or the person at our table may see and feel, are that those changes occur secondary to that. I do a lot of stuff on pain science in my other courses because I really feel that having a better understanding of pain really helps to inform what it is we're doing. But the only thing I want to say about pain in this is that pain is the number one reason why people come to see us, usually. About over 85% of visits to any healthcare provider, any MSK provider, even higher, is because they hurt. And pain is stopping them from doing something. The sensory structures that are responsible for pain is the nociceptive apparatus. The nociceptors are uh, basically receptors that connect to the nervous system that are found all over the body. What I want to get from the science of massage therapy is to understand that when somebody is hurting, when someone's experiencing pain, we can say and we can know that there's some type of activation of their nociceptive system or nociceptive apparatus, which means that there's something happening in that area. Just for example, here, I'll show the front of my shoulder. If it hurts here, I know that there's something happening in and around there that is irritated and that's triggering nociceptors to fire. As a massage therapist, when someone has pain in that area, we want to make sure that the treatments we provide to that area don't add more fuel to the fire. So we should make sure that our treatment feels good without being overly aggressive, because if we go in there and we start grinding away and trying to break stuff down and make the person hurt, what we're potentially doing is we may get a temporary relief of symptoms because there's a whole other cascade of things that can happen. But what we also might be doing is we might also be sensitizing these receptors more, and it actually could leave them with more pain. So the best approach when someone hurts is to find a touch that feels familiar, it feels good, it feels like it's in the right spot, but it shouldn't be something where they leave feeling more inflamed, because the last thing we want to do is make a sore area more sore. And that was a hard thing for me to kind of understand and take on when I first started kind of down this journey, because I came from an athletic background where massage and manual therapy was often aggressive and you know what, it works for some people some of the time, but for a lot of the people that are suffering and living with pain, particularly the chronic pain patients, that approach where you're inflaming and irritating is just not always the best one. And I think the research suggests that. So a quote here from a great book, Occupational MSK Disorders by Norton Hadler. When we look at what do you do for pain, what do you do for people that hurt? And there's lots of evidence out there that says this doesn't work, this doesn't work, this doesn't work. There's lots of evidence that suggests nothing really works that well. But this quote is great. It says, "The best management is not to do nothing." If people could cope on their own, they would not be patients in the first place, which makes sense. People come to see us because they want our help. People need to understand that natural history is on their side. Injuries will tend to heal along very, very predictable timelines. If someone has some systemic disease process or a history of pain in an area, they're probably going to have flare-ups and calm down periods. So natural history on the side means that things will tend to get better over time. The challenge, though, is how to cope more effectively until remission. And he goes on to say, reassure on the basis of steps 1 and 3, but exploit whatever therapeutic insights might derive from step 2. Be a wise port in the storm, even if the storm will rage despite your efforts. And I read this and it really, really stuck with me, because people come to see us, and if they're going to hopefully they're going to get better eventually. But what can we do to make their journey to better, whatever better might be? How can we make that journey more enjoyable, less suffering? By being that wise port in the storm, we can be that place of safety and of feel good and of helping them as an entire human feel better until their body does what needs and they recover. That really resonates with me. I think that's a really powerful thing. Another way you could say is just be their safe place to land. People have their lives, they've got their things going on, they're lifing, they're busy, they're in pain, they're stressed, they maybe have some mental health things. As long as we can be that safe place for them to land and provide a treatment that's within our scope of practice, using whatever techniques, modalities, things we like to do, I think if we do that, we're giving really good therapy. There is not a right or a wrong way. It's a way that works best for you and for the person in front of you. This becomes really important too, particularly for people that are living with chronic pain. Going back to what's the science suggests? Well, I was a co-author on this book or this paper from a couple years ago. There's my name down there with four other or three other massage therapists, and we did like a research review, a literature review on everything we could find about chronic pain and what's the best things for that. And there's not a lot of stuff that works really well for chronic pain. It's all over the map, so to speak, in terms of what works and what doesn't work. The key thing, though, one of the key findings was the language we use. So choose our words carefully. And this is why I kind of start off this presentation talking about the the science and what does massage do or what can we defend? Because how we think implement or impacts how we communicate. It impacts our expectations and impacts the expectations of our clients as well. So we want to avoid saying things that people like avoid finding dysfunctions and blaming those things for people's pain. That approach of that very structuralist approach, particularly for people who have chronic pain, may not always be the best because it can oftentimes make people feel weak, broken, can take away their sense of control. And the second key takeaway here is we really want to build relationships with people. If we can form a good, strong relationship, a bond with a client in a positive therapeutic way, that shows that people are going to likely have better longer term outcomes. So just by being a good human. So the focus that we want to do with looking at the science of massage and the science of touch is we want to move away from this dysfunctional model where people are broken and where there's always a problem that we need to find and fix and move more towards pain modulation. So we can still work on those areas. We can still do those things that we've always done. But the goal is more, can we make the person feel better? Can we modulate their pain so they hurt less? By doing that and focusing on the pain relief first, it can help to inform or it can help to change some of those so-called inexperienced dysfunctions. So again, we're flipping that script of what is common. And here's another paper that looks at the impact of our words and so saying even if we say simple things like, oh, your pain is all because you've got this rotation here or this is tight and this is loose and you need to do this, you need to do that. Those things can be part of the overall picture, but we should try and frame those as much as we can in a positive way rather than you're so broken you need to come see me a million times to fix it. I'm not saying that we all do that, but that is a common understanding that patients have. And this is a great quote here. It says, people trust their clinicians, who are still the primary source of information and advice despite the growth of the internet. The current study furthers understanding of how and when various sources of information contribute to beliefs, highlighting that clinicians can have a profound and long-lasting influence. Recovery expectations can be heavily influenced by single, at times offhand statements. This finding is important given that low recovery expectations are a strong predictor of poor outcomes. And this is based on what we call qualitative data, which is data based on interviews and conversations with people that live with pain. So this is the personal experience. So this isn't just like random numbers in a large study. These are interviews with people that are living with this. So what we say and how we say it matters a lot. Some other research, though, does suggest that of all hands-on interventions, For neck pain, patients have a large or clients have a large expectation of benefit from massage therapy. And these beliefs that we have, again, can predict outcomes. Not always, but they're better than average. So if we say that I think I've seen this before. I've treated lots of people with whiplash, and normally people feel better in 6 to 8 weeks. Let's come up with a treatment plan. I think by that time you'll be feeling much better. You're putting that expectation on them, giving them some control, and allowing them to have hope that they're going to get better. Now, obviously, for extreme cases, where there's like fractures or some just disabling injury, doesn't the impact is not going to be the same. But for the most people that we see, most musculoskeletal things, if we have positive beliefs in people, they're going to take that on, and the outcomes are probably going to be better. And we do all this. This is called contextual analgesia, which is more about the treatment act matters more than the specificity of the intervention. So the fact that we're doing something, people are feeling better. And we've seen this lots probably in clinical practice where people, they call or they book an appointment or they're online and they come to your office and they say, hey, you know what? My back was just killing me the other day. But now that I'm here, it's actually feeling quite a bit better. It's almost more like there's this expectation. It's helped them before. And the fact that you're going to do something which they know is going to feel good might be something that starts a process of helping them to feel better. And I think that is something that we should really embrace as a tool. I think this is more than anything, this is empowers us rather than takes anything away. And when we're doing these things, I said before, we want these things to be positive. So treatments delivered in an honest and positive context perform better than those delivered in a neutral or negative context. This is the worst back I've ever seen. Oh my gosh, how do you survive? Your shoulders are so tight. That kind of language, which is so common, and patients or clients often want to hear that from us, is very common. And is that problematic? Probably not for most people. Most people can probably hear that and it's fine. But we don't always know who that is. And that's why we have to be careful with the the language that we're using and the beliefs that we're bringing to the treatment room. Because what we do is with our hands is extremely powerful. But what I would say, and I think some of the evidence here, some of the science suggests, is that how we bring ourselves to the room, how we communicate, how we listen or don't listen, the space we hold for people is probably a bigger predictor of positive outcomes than what we are always doing with our hands. We put those things together with that feel good touch as well as that environment, that safety, the communication that empowers people, makes them feel safe. We do that. That is going to, I think that is the science and the art, which I've said before, but I just want to emphasize that again, of delivering good quality, science-based care. So you put this together, what's massage look like in a science-based understanding? Just a quick summary of this is it influences the pain experience. We can turn the volume of people's pain up, or we can turn it down. Our goal should be to try and turn it down. If it does go up, it does happen. We've all experienced that, but that shouldn't be our go-to every time. Increases overall sense of well-being, so the sense of self, psychologically, socially. It helps the mental health. It can help with sleep. People that get massage tend to sleep better afterwards, or maybe on the table. Building confidence in themselves, and just being a good listener. And this is something that in the in-person courses that I teach, one thing we always try and focus on is not interrupting and not asking too many questions, but asking a couple key open-ended questions, allowing the person to share. Because if we look at some of the kind of the psychological literature about communication, allowing the patient or the client to be in control of those conversations so we're not just berating them with a bunch of questions is one of the best things we can do to really kind of build that relationship. And in terms of techniques, what techniques should you use? What touch should you use? People often ask me, well, what's the science of this? What's the science of that? And just going to summarize it. I'm going to say there's one technique to rule them all. I just jokingly call this TPN, which means touch people nicely, which means find your technique, find your approach, find your modality, whatever you want to call it, whether it's Swedish or fascial or cranial or MLD or anything under the sun. As long as you're doing it in a way, in a style that feels good to the person, it can't be wrong. How can one technique be right and one be wrong? They're all just different ways of interacting with somebody. They're different ways of applying pressure or applying movement or both. All the different modalities and techniques out there come with different explanations, different narratives. But if we look at what's similar with all of them, they're all just different forms of touch. If we accept that they're all part of the overall way of touching people in a way, massaging people in a way that feels good, I think we would have less conflict in the profession where people are trying to say, hey, this is the best way, this is the best way. There is no best way. It's whatever works best for you and the person on the table. So our treatments, so if we're providing a treatment in a system-focused way or a science-based way, this is the approach that I teach. This is the approach that I find works for me. I think it's based on evidence. It's based on kind of some of as well as 20 years of experience. But again, we're trying to make the air feel good by desensitizing it. Our positioning, your position on the table should be a way that's most comfortable for the person. Move, right? So work on an area, but push, pull, twist skin, move muscles, move joints, move limbs, move it all, right? Hang out, be kind and wait. Some of those neurophysiological mechanisms we talked about earlier, those are most likely to be turned on. Those are to be activated through slow, sustained touch. So work slow, don't work fast. And can you get them to move? Can you get some relaxation, or some active or passive range of motion in through the body? And just following this kind of protocol here, you can use this for any body part. Jaw, shoulder, back, hips, lower extremity, doesn't matter. As long as you follow this system, this principle-based approach, and understanding and using the fundamentals of what we talked about earlier, I don't think you can go wrong. I think you can be really, really powerful. So your professional journey, some of this might be new information for you. Some of it maybe confirmed your biases. I'm not sure. But I really like to challenge people to take something a little bit different in the profession. Go to conferences, try and gain knowledge, try to get something that's a little different from what everybody else is doing. The stuff that's really exciting is things that involve new techniques, new modalities, mechanics. That all has a role. But I think that if we want to really take the profession to a different level, things like clinical reasoning, communication, maybe some assessments if you're allowed to do assessments depending on your scope of practice. These things aren't always as easy to sell, but I think they are all really, really powerful things to start exploring. Go to a pain conference. Go to a conference on or some hard science about, neurophysiology. That kind of stuff is really cool. And it really challenges the brain, which I think is something that's really important. So that's it. So thank you for being here. I think we're right on time. You can connect with me. I highly suggest everybody that's here, please, I have a podcast. It's called Massage Science with Eric Purves. It's on all the major podcast networks. You can download it. I got a whole bunch of episodes on there where I go into some of the stuff a bit more. And my website is thecebe.com. So please visit there and see what else I have going on. I do all kinds of webinars and courses and stuff. And please follow me on social media. So if you have any questions or you want to reach out or comments or you want more resources or information or anything, please, Facebook or Instagram is probably the two easiest ways to get a hold of me. Please do that. And I know uh, Biotone is a sponsor of this, but I also have an official sponsor. So I'm just gonna make a little plug for Notero, which is a company that I'm an official partner of. They sponsor a lot of stuff I'm doing. So they do clinic management, booking, billing. If you want to try them out, they have a 44-day free trial, so please check them out, notero.com/CEBE for your 44-day free trial. Thank you.
Well, thank you, Eric. That was really a very nice presentation and had me thinking about my own experiences coming into a massage and the first initial touch. The I appreciate when the therapist actually checks in with me. You know, how is this pressure? Is this okay? I mean, that's really appreciated and establishes trust at the same time that they're with me. Their hands aren't just moving and their mind is somewhere else. They're actually paying attention to me. So this is excellent information to share, be reminded of, or accept this as new information. We did have some chats come in, so let me get to those. What I'd like to mention to people before I get into the chats is that tomorrow there will be a follow-up email. It will have a copy of Eric's PowerPoint, link to the recording, and again, Eric's contact information. If you don't see that in your inbox by midday, please check your junk or your spam folder. And if not there, feel free to reach out to me and I will resend you the follow-up email. And with that, Janice is asking, is there specific terminology you like to use with clients on how to communicate their needs about massage pressure and depth while doing touch therapy?
Oh, specific language. I would say I don't like to provide a script of what to say or what not to say, but can you just read the question again? What was the first part of it?
Okay. Is there specific terminology you like to use with clients on how to communicate their
Their
needs
needs.
about massage pressure and depth while doing touch therapy?
Yeah, okay. Yeah, thank you. Yeah, it's a good question. So I keep it really simple. So what I do in clinic and what I do when I teach is I use this term same, better, or worse for pressure. So I'll say, I'm going to start off with this kind of pressure. Let me know, is this feel good? If they say yes, and then maybe I'll change. Maybe I'll put a little bit more, a little bit less. Maybe I'll put a different stretch into the tissue depending on what I'm doing. I'll say, how's this feel? Same, better, or worse? And I find that just gives them control. It makes them not think too much, and it allows me to adjust as needed.
I'm laughing because sometimes I've been getting a massage. Oh, that feels great. And then the therapist moves to a different spot.
I
So
know. It's
I
crazy,
don't
isn't
get
it?
it.
Yeah, it happens all the time.
I
If
don't
everybody
know.
watching my experiences and Donnell says the same thing. If it feels good, don't leave it. Hang out.
Thank you.
Yeah.
Deidre, Eric, thank you. I'm a huge believer that the therapist, our words make a difference. As a therapist, our words make a difference. I am also surprised how many clients say therapists aren't having conversations with them. I find that once clients unload mentally, my touch is much more therapeutic.
Yeah, I think there's a lot to that. The not really a question there, but a comment, but just so I think I appreciate the comment, but it's a fine line of do we talk or do we not talk? And it comes down to the person. And I personally feel, and from my interpretation of the research on this, is that providing the opportunity for people to speak and not shutting them down is hugely, hugely important. Because I agree with you that when people can start to share their feelings, what's going on, they start to feel safe and better. I think you can have that connection with them, and you can actually probably provide uh, probably a higher level of care because you've created that human connection, which is so important, which is one of the key things I was trying to get through or get to today. So thank you.
Renee is agreeing that if we start talking about what they need and not just what we know or have been taught, it is so important. You are spot on.
Thank
And
you.
Andre, thank you. Excellent. Sarah, thank you for this amazing information. Thank you, Eric. It's a valuable talk. TPN, touch people nicely. Going to use that one and obviously give credit to Mr. Eric, and that was Thomas.
Thank you.
Renee is addressing Deidre. I agree that a lot of therapists don't talk or take the time with their clients. We have to, so that we are sure that we do no harm. And Renee responds, Deidre responds, Renee, that is part of the session. Once they relax mentally, I am able to do my job more effectively. It's sad that is not more of the norm, and agree. So Deidre is saying, hang out.
Yeah.
And Shani is saying, thank you. So some good points and good sharing.
Yes. Yeah.
And
Appreciate everybody for sharing those. That's it's nice to hear.
you never know. I mean, I feel like burst into the massage room from a hectic day. The traffic was crazy. I might be a minute late. And just taking time with your client to, whether it starts with just the hands on the back or some breath work, just to get the client more comfortable, and then they're more receptive to the work that you'll be doing. And
100, yeah,
I
100% agree with that.
appreciate that.
Yeah, 100% agree with that. Yeah,
Yeah.
sometimes, so many of us, it doesn't matter where you live in the world, we live in a very hectic world, a very hectic life. And massage can be, through all the stuff we talked about tonight, can be one of those things that is such a powerful influence on just making people feel better. And I think that's a gift that we have, and I think we should really exploit that in a good way as much as possible.
Well, Eric, we're going to be wrapping up now, and I'd like to give you a last word. Anything you'd like to share with the audience?
Yes, I sure do. So thank you to Biotone, and thank you for being part of this, sponsoring this EduTalk series. So what I wanted to say is, obviously thank you for everybody that's here live, and for those that are recording, and thank you to you, Danelle, and to Biotone for this opportunity. I do have a discount code available, so anything on my website. So the cebe.com is my website. You go there, you can use the 25% off discount code for Biotone25. And yeah, I got webinars on there. I've got self-directed courses. I have some in-person courses, but you're probably, those are coming up pretty quick, and probably most people don't live close by for those. But anything you see on there at any one time, just you can use that code, and I do have a limited amount of them. So if you want to use it, do it. So thank you.
And the code will be in the follow-up email tomorrow. Um, and please join us again for upcoming Edu Talks. We have October 7th, Sandy Fritz will be presenting on being both effective and efficient for career success and longevity. Then on October 21st, we will have Irene Diamond presenting on simple neck pain relief through active modulation therapy. Sandy's October 7th. Um, being both effective and efficient. EduTalk will open, the RSVP will open tomorrow. There will also be a link in the follow-up email. And our EduTalk Diabetes series, for you, those of you not familiar with that, November 11th, we invite you to join Linda Lockett Brown. She'll be presenting You Can Enjoy This Holiday Season with Diabetes. I'd like to mention that both EduTalks, the diabetes series and the massage series, can be accessed through biotone.com under the EduTalk tab. And the massage series has over 5 years in the archive library. Excellent talks can be found there, as well as the EduTalk Diabetes series, which launched in May 2023. And those talks, many of them are presented by massage educators, but valuable information just for everyday life. And more thank yous have come in, Eric. So again, I thank you. Thank you for this valuable information. And we hope you join us again in the future.
Yes, I'd be honored to. Thank you very much, and thank you for everything.
Okay, and thank you everyone for all you do. And we'll see you next time. Take care.
Bye,
Thanks,
everyone.
Eric.